temporal arteritis. Now when we talk about temporal arteritis, the other name for temporal arteritis is giant cell arteritis, right? So what are the important point about temporal arteritis or giant cell giant cell arteritis. Temporal arteritis is again a immunological process which is producing severe inflammation of temporal arteries, but it may involve vertebral arteries, it may involve maxillary artery, it may involve the ophthalmic artery, right? And rarely temporal arteritis may also extend its inflammatory process to aorta. Is that right? But of course, you will differentiate it from Takayasu's due to the old age of the patient, in which temporal arteritis start ages more than 50 years, right? Usually temporal arteritis is more common in the population which is descendant of Nordic origin. The people who are of Nordic white European people who are descendant from Nordic, Nordic, right? Nordic origins, right? These people have more chances as compared to other population to suffer with giant cell arteritis. And in giant cell arteritis, what is really the pathology is that there is typically a granulomatous inflammation in the media of temporal artery, right? And the temporal artery, let me draw that this is suppose a temporal artery, and here is internal elastic lamina. This is internal elastic lamina, and actually inflammatory cells, right, they are attacking the internal elastic lamina, and you find some of the inflammatory cells, there are just, what is this, lymphocyte, some of them are macrophages, some of the inflammatory cells are neutrophils, some of the inflammatory cells may be eosinophils, but very distinctly there may be giant cells. And giant cells are of two types. In some giant cells, multiple nuclei are in the periphery of the cell, we call it Langhans giant cells. The other type of giant cells, I think I must make it really giant or big cell. Some other type of giant cell, multiple nuclei are arranged, scattered in cytoplasm, right, randomly. So these are called foreign body type giant cell. It does not mean there is a foreign body. This is foreign body type giant cell. So in giant cell arteritis or temporal arteritis, histologically if you study, take a biopsy of the vessel. Remember, this disease is segmental. It does not involve the entire vessel. It involves different segment of the vessel. That is why when you have to do biopsy of the temporal artery, you have to take at least 2 to 3 centimeter length of the temporal artery. In biopsy lesions, in classical cases, you will find that there are granuloma formation, and these granuloma consist of multiple types of inflammatory cells with some giant cells, and these giant cells may be of Langhans giant cells, or they may be foreign body type of giant cell. But remember, these giant cell arteritis or temporal arteritis has 70 to 80% of the patient typical granuloma, which are specially attacking and destroying the internal elastic lamina. But in about 20 to 30% of the patient with the temporal arteritis, they may not be typical giant cell, they may not be typical granuloma. You may find inflammatory cells, right, mononuclear inflammatory cells scattered throughout the media of the vessel. Am I clear? Due to this severe inflammatory process, this artery become inflamed, and intima may be so inflamed that thrombosis may develop in the intima, and if process become chronic, right, it may lead to fibrosis of the artery wall as well, right. Clinically, these patients, again I must mention, the temporal arteritis is the most common systemic vasculitis in adult. Temporal arteritis is the most common systemic vasculitis in the adult, and it may be chronic or it may be acute, right? And it is usually classically granulomatous inflammation, right, which may involve the temporal artery or ophthalmic artery. Remember, when temporal artery is involved, what are the features? You find there's some tenderness in this area, and there's pain and tenderness along the, you can say, course of the artery, and artery may be nodular. Is that right? And with that, another important feature is that if ophthalmic artery is involved, that may produce blindness. That is very important. That is why in these patients, as soon as we suspect that patient is having temporal arteritis, we give the patient high dose steroids. It means 60 to 80 milligram prednisolone every day. Why we treat this by high dose steroids? Because we don't want to take risk that severe inflammatory process of ophthalmic artery or its branches produces blindness, which may become permanent. Again, temporal arteritis, patient has a very high ESR. That's one of the also very important feature of this disease. Very high ESR, tenderness along this thing, and if he develop, you can say, blindness, you have to give very, very high dose steroid to save the vision. Is that right? To save the eye, because this blindness may be permanent, right? This is one complication. Secondly, if maxillary artery is involved, patient may develop jaw claudication. Now, what is claudication? Claudication is a special type of pain which develops in the muscles when muscles are working more and their arteries fail to dilate and supply extra blood. Again, listen. What is claudication? Claudications are the pains which are resulting in the muscles, originating from the muscles when muscles are working and their arteries or arterioles fail to dilate and provide extra blood. Now, if giant cell arteritis goes into maxillary arteries or other arteries which are supplying the muscles of mastications, then when you are chewing or you are masticating, at that time muscles of mastication need more blood flow, and if these inflamed vessels in temporal arteritis fail to dilate and fail to provide extra blood, patient may develop jaw claudications or pain on chewing or mastication, right? So these patients clinically may develop facial pain, may develop pain in the temples and tenderness in temple area, may develop jaw claudications, and these patients may also develop giant cell arteritis. Some patients may develop inflammatory process in the vessels which supply the nerves. You know, big nerves also have their blood supplied by vessels. Those arteries which supply the nerves with the blood, those arteries are called vasa nervosum. Sometimes in different nerves, vasa nervosum may become inflamed due to giant cell arteritis. And if vasa nervosum become inflamed, then naturally some segments of the nerve may not be supplied with the blood, and some segments of the nerves may become ischemic or infarctive, right? And if different nerves at different part of the body may undergo this type of dysfunction, we say there is a mononeuritis multiplex. What is that, the name? Mononeuritis multiplex. Is that right? So again, let's come back. This is a disease of, what is the age? 50 and plus, right? Especially population from Nordic origin. Predeletion for involvement of temporal arteries, right? And in 70 to 80% of the patient, classical granulomas with giant cells are found on histopathology. But in 20 to 30% of the patient, you just find diffuse infiltration of the vessel wall with chronic inflammatory cells. And important part of the treatment is that you give high dose steroids, especially when you suspect there is going to be inflammatory process in ophthalmic artery. Now the most important point about this disease, the giant cell or temporal arteritis is in 50% of the patient associated with a condition called Polymyalgia Rheumatica. What is that? In 50% of the patient with temporal arteritis, they may have another condition which is called Polymyalgia Rheumatica. What is Polymyalgia Rheumatica? In this case, patient develops pains in proximal muscles of the girdle. For example, muscles of the shoulder develop pain, and muscles of the hip girdles develop pain, right? Polymyalgia, the multiple muscles are painful. Which muscles? Proximal muscles of the girdle, hip girdle and shoulder girdle. With that, underlying joints develop pain in the periarticular tissue, right? So in the shoulder joint, you know, periarticular tissue, capsule of the shoulder joint, or tendons around the shoulder joint, or ligament of the shoulder joints. In the same way in the hip joints, there is inflammatory process which produces pain. So patient has periarticular inflammations and patient has pain of proximal muscles. This patient may have difficulty in combing his hair because he cannot move it. Plus, if he comb comes on the temporal artery, if he does have a hair here, in that age, I don't think I will have hair by the age of that, but anyway, I will arrange transplantation. So let's go back to these patients. If they comb their hair and come at the temporal, of course, temporal artery is inflamed, they will feel pain. Secondly, when the combing in 50% of the patient where there's polymyalgia rheumatica, these muscles are also painful, so it is difficult for them. Or to wear the coat, to put on the coat, they find it difficult, right? And even from a sitting down position to stand up, you have to use the muscles around the hip joints, so that may also be painful or difficult. Is that right? So again, temporal giant cell arteritis involves a person who has aged more than 50 years, and in 50% of the cases, this condition may be associated with polymyalgia rheumatica, right? And don't forget, ESR in these patients is very, very high, right? When you give the steroids in temporal arteritis, of course, steroids are very good. They reduce the inflammatory process, they reduce the ESR, both, right? Let's have a break.